Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I'm sorry I'm running a few minutes late. It's been one of those longer days here at Marty Ross MD Healing Arts, but I'm here to help you as best I can tonight. For those of you that are new, you get to participate in a couple ways. One, you can listen to the questions and the responses that I give to them. The other way you can participate is actually write a question. And the way you do that is over on the bottom of the right-hand side of the screen is a chat box that you can write your question to me. I ask that you be brief with those questions. Long questions don't work well in this format. The other thing I ask is that you only send a complete question to me by hitting the enter key. So if you try to create paragraphs by hitting the enter key multiple times, it creates multiple questions. It gets to be a little bit hard for me to follow from my side, okay? For those of you that are back here again, I've seen a number of new or familiar names actually, and a number of new names too. But I'm glad to see those that have returned, that you're getting value out of this, and that you keep coming back. And I hope I have something to offer you tonight. So for those of you that are interested, I am creating a recording, and that recording I will have available for you tomorrow morning. Usually by 9:30 in the morning, Seattle time, sometimes earlier, sometimes a little bit later, but I try to get it done in the morning. I have to do some brief edits on the video tonight, and then I try to create just a brief synopsis to send out with the video recording describing what we talked about. Okay, so that takes a little bit of time for me to go through that. And then you probably may be aware, but that is Mr. Thor back there. That's Thor. You may see him moving around. He's one of my Basenjis, and I have another Basenji named Halo, who's generally just not that active during these webinars. She kind of hangs out underneath my desk here, but we may see her as well too. So anyhow, that's what's going on with all the movement here in my office. So I think without any further ado, let's go ahead and get started here. All right, this first question is from Tim. One thing I want to say, in the live version of the webinar tonight, you will be able to see the questions. As I read them, I post them on your screen. The only problem is in the recorded version, those questions don't show up on the screen. So I will read them out loud. That way, anyone that's participating in this, including in the recorded version, has a chance to know what we're talking about. Okay? All right. So this first question is from Tim. Hi, Dr. Ross. I hope you're doing great. Thank you. Let's see. Last week, I had very bad allergic reaction to Plaquenil. My entire body was covered in a rash. I finally have it under control a week later, and so I was just wondering if any nutrients were depleted during all of this, or if you have any other general thoughts about aftercare. Thank you so much. So Plaquenil, everyone, is a quinine-like medicine that got a lot of notoriety in the COVID-19 early in the days, as our President Trump actually had recommended it. And actually the science kind of has come out questionable as to whether it really has any benefit about it. So that's where many of you may have heard about it. But in the world of Lyme, we actually use it, and we use it for a couple reasons. One, it helps decrease inflammation. Second thing that it does is it changes acid levels inside of your cells, which can make it so that antibiotics that work inside of the cells, intracellular antibiotics that we use to treat Lyme that lives inside of cells and Bartonella that lives inside of cells, it makes it so that those intracellular antibiotics work more effectively. So things like doxycycline, the tetracyclines, the macrolides, which would be azithromycin and clarithromycin, they seem to work better in an acidic environment, an environment that is not as acidic, more basic, and Plaquenil does that, okay? And then finally, Plaquenil, as a quinine derivative, may have some benefit in treating Babesia. Probably is best used as an add-on agent when we use a medication to treat Babesia called Primaquin. And my go-to treatment these days when everything else is failing for Babesia is to use a combination of Primaquin and Plaquenil together. And that seems to give some pretty good results, okay? So anyhow, that's what it's used for. Now, if you get an allergic reaction, that basically the immune system is reacting against the Plaquenil by releasing and making a lot of histamine chemicals, all right? I am not aware of any nutrient depletions that happen from an allergic reaction like this. I haven't seen anyone describe taking nutrients as a part of recovering, nor am I aware of that, all right? So I don't have any thoughts about that. And actually, other than just stopping the medicine and waiting for your body to adjust, I don't have any ideas for you. If this was more acutely, I would be telling you to take some antihistamines like Benadryl. I might even have you take some mast cell stabilizers like a quercetin, but you're pretty far out from it now. And I really don't have anything to offer for you in this situation. All right. Good luck to you, Tim. Hello, B. Let's see. I wanted to give you the Schardt. I wanted to give the Schardt protocol a try. Is IM penicillin, bicillin, more potent than oral antibiotics follow after a course of fluconazole? Can tetracyclines, doxycycline be given while on fluconazole, or should they be given after a course of fluconazole is done? Also, can you explain why the significance of what the significance of cytochrome P450 is in the pharmaceutical or herbal treatment of Lyme? Should grapefruit be avoided? All right, a number of questions here. All right, let's talk about Schardt protocol first. So Schardt protocol is a protocol that probably came back maybe about 15 years ago. I mean, I remember this from the early days, my early days managing Lyme disease, which was back in 2004. And at that time, the physician that I trained under was just starting to try the Schardt protocol because it's something that had come out. Dr. Schardt is, I believe, a physician from the UK in the United Kingdom, and proposed a theory that if you used fluconazole followed by antibiotics, so don't use them simultaneously at the same time, but if you use fluconazole, I believe for, I think it was 30 or 45 days of fluconazole followed by 30 days of a prescription antibiotic, that you could get benefit in Lyme. And what his theory was is that fluconazole, he contended that it would interfere with the detox mechanisms of the Lyme germ. And so if you blocked detox and then you slammed the germ with an antibiotic like an amoxicillin, that it would leave the germ more susceptible to the amoxicillin. Okay, that was what his theory was. Now, subsequently, I think I've learned what I see in my practice. I think fluconazole also has the ability to treat the cyst form of Lyme. And so one of the ways it may work is actually doing that. I'm not clear if it does anything to detox. And nor did I have much benefit using the Schardt protocol when I did try it in my practice, okay? So I just want to say that. So in terms of the Schardt protocol, my understanding at that time, and I haven't looked at it in a number of years, okay? I mean, a long time I haven't looked at it, but Dr. Schardt wanted you to use what are known as cell wall agents, antibiotics that actually block the ability for the Lyme germ to repair its covering, okay? Those are called cell wall agents. And those would be things like the penicillin, so amoxicillin or bicillin could be an option there. Or they would be things like cephalosporins, like a cefuroxime or a ceftonir, okay? And in terms of all of those, bicillin may be more potent than doing the oral versions. In terms of your question, should you take tetracyclines at the same time as the fluconazole? If you're trying to run a pure Schardt protocol, I would not. You're trying to use his theory, which is block the germs, detox, and then try to slam it. I probably would not be using antibiotics of any kind at the same time. All right. So cytochrome P450 is used as part of liver detoxification of a number of chemicals, and it interfering with it may change drug levels of certain chemicals. Okay, and so grapefruit juice has a chemical in it that interferes with cytochrome P450's processing of various chemicals, and so you may get I believe it blocks the processing, so you may get elevated levels of certain chemicals. There are other chemicals, I believe, that grapefruit juice may even make it so they don't work as well. It lowers their levels. Okay, so it all depends on which antibiotic you're on or which medicine you're on. Some of them have explicit warnings not to do grapefruit juice. All right, now I want to make a distinction. There's grapefruit juice, and then there's another supplement we use in Lyme disease called grapefruit seed extract. Okay, so grapefruit seed extract is an extract that comes from the seed of the grapefruit, not from the juice of the grapefruit. And the chemical that interferes with cytochrome P450 is made exists in a large quantity in the juice, but as I've looked at it in the past, exists in microscopic to almost non-existent amounts in grapefruit seed extract. So I usually I will use grapefruit seed extract even in medicines that say don't use it with grapefruit juice. I will use grapefruit seed extract, and I haven't seen any problems develop with that. Okay, so I use grapefruit seed extract, many of you may know, is one of the herbs that we can use to treat what is known as the cyst form of the Lyme germ. So the Lyme germ has two looks. It has a spirochete, sometimes like a corkscrew, and that spirochetes can morph into these microscopic forms of the germs called cyst. Okay, that's what the germ looks like. And then to add more confusion to the Lyme world, we now know that Lyme also has these things called persisters. All right, and so let's talk about that. So you have cyst, you have spirochetes. These cysts and spirochetes can grow, okay, or they can go into hibernation. And if they go into hibernation, they slow their metabolism way down and they ignore the standard antibiotics we throw at them. Those forms of the germ, or when the spirochetes and the cysts slow their metabolism way down, go into hibernation, those are called persisters. Okay, so persister is more of a growth state of the two forms of the germs, basically. Okay, all right. Good luck to you, B. Hello, Jim. Let's see. Thanks for your great work. You're welcome. Let's see. Do you think it's okay to take supplements and medications after their best before or expiry dates? If so, how long after? Are there any meds or supplements that you should not take after expiry dates? One particular supplement I wonder about is a box of ProBoost with an expiry date of September of 2020. Should I take this? All right. So, let's talk about expiration dates. So expiration dates are artificial. No one has actually gone out and done studies to say with these various medicines or supplements, how long do they remain active? I've never seen studies that do that, okay? The military here in the States a number of years ago, because it was having to throw out a lot of prescription medicines that had gone past their expiration dates, went ahead and studied a number of these prescriptions and found that the chemicals were still active in these things. And in general, here in the States, I think expiration dates are set a year after something is manufactured, whether that is supplements or whether it is prescription medicines. So in general, they're artificial dates. Now, is there a point at which something might not work as well? Perhaps. I don't have a firm date on anything, though. Okay, so for instance, herbal tinctures, which are in alcohol, the chemicals in those probably are preserved forever in the alcohol. So those things may last years to decades, for instance. All right. If you've got something that's heat sensitive, like a probiotic or something growing, I tend to say probably stay closer to about a year on those. And this is just my opinion. All right. I think most other things, I think you can use probably within, probably a year or maybe even 2 years after an expiration date. Now, I'm giving you my opinion because people have not gone in and studied most of these supplements or prescriptions to know how long do they remain active. But the thing I want you to know about expiration dates is they're artificial. Somebody just said we need to put a date on there of about a year after it's manufactured. Okay. All right. Good luck to you, Jim. Hello, Mike. Let's see. Hello, Dr. Ross. I have been taking lumbrokinase for biofilms along with my antibiotic treatment. I saw that Research Nutritionals has a new product called Biodisrupt, which is less expensive than lumbrokinase. Is the Biodisrupt an effective alternative for targeting biofilms? Yeah, it is. Lumbrokinase, which is a group of enzymes that come from earthworms. I just love managing this crazy illness. I mean, some of the things that we have to resort to using. Enzymes from earthworms, all right? But those enzymes from earthworms, the way that they work is what a biofilm is a biofilm is a slime layer that covers the germs, and it's held together in a protein skeleton, all right? And that protein skeleton comes from blood clotting proteins called fibrin, and the bacteria basically take that fibrin and they turn it into the protein skeleton of the biofilm. What lumbrokinase does is it breaks down that protein skeleton. So it works in one way, all right? The Biodisrupt has a number of enzymes in it that can break down both the protein skeleton as well as the sugar slime. In addition, they have some components that keep the biofilms from even aggregating together. And there's a number of other mechanisms by which the Biodisrupt works too, okay? And because it works through a number of different mechanisms, it actually might even be more effective than lumbrokinase because it's approaching the biofilm problem through multiple mechanisms, okay? Now let me see, I think I may have even written something about this before because I don't remember all the mechanisms off the top of my head. I hope you appreciate it's hard to remember everything in medicine, but let me just do a quick screen share here because I think I've written about this and we'll look at it together. All right, so this is my Lyme disease information site. And let's see if I have done something on Biodisrupt. I have. Oops, do that again. Here we go. Okay, so I've written a whole article about biofilms. And let's see here. I'm just looking to see what I've said here. Yeah, I don't think I said enough about it here. Anyhow, it does, oh, here it is. So it has enzymes in it that break down the sugar and the proteins. It also has a number of herbs in it that block something called quorum sensing, which is a method that biofilms use to migrate. It seems to interrupt the adhesion, the stickiness of the biofilms, and it prevents a quality of biofilm called swarming. So anyhow, it works through multiple ways, okay? So it works through more mechanisms than what the lumbrokinase does. And so it may work better. I think what I have found in my practice in working with it as well as working with lumbrokinase is it's very individual. Give it a try, see what happens. Okay, all right, good luck to you. Hello, Dominic. Let's see. Hi, Dr. Ross. Hope you had a great time with your dad. It was an interesting time with my dad. What Dominic's referring to is I helped my 90-ish-year-old father move into assisted living. And so as you can gather, that would be a very challenging time in his life. And therefore, it was a challenging time in my life. But it was still good to see him. And it was nice to visit with some friends and family out in Colorado, which I never grew up there, but it seems a lot of people I know have migrated there. So I was fortunately able to visit with a number of people out there too. So thanks for asking about that. Let's see. Question, is azithromycin 500 milligrams and Malarone hard on the liver, and can they elevate your ALT and AST levels? If they elevate levels, does this normally happen during the first couple of weeks using the meds, or can it occur at any time? Lastly, can you occasionally have a glass of wine while taking these medications? Thank you. So the most important question or most important answer is yes, you can have some wine. I would still limit. I mean, I think a glass of wine here and there, maybe even a couple times a week, I don't think you're going to hurt yourself with that at all. All right. In terms of azithromycin and Malarone in the liver, in theory, more the Malarone than the azithromycin may lead to some liver inflammation. That's in theory. I have to say, and I use a lot of Malarone in my practice, I have not seen anyone come back with elevated liver enzymes, which is this ALT and AST that you write about here, okay? That's not to say it couldn't happen. It's just that it's extremely rare. And in all the years I've been managing Lyme disease, I have not seen that happen. And I have not seen that happen on azithromycin as well, too, okay? I would think if it is going to happen, it's probably going to be within about the first month. And generally, if I put somebody in these medicines, sometimes I will do like a liver function test, AST and ALT, within about a month of starting the medicines just to see how their body is tolerating it. But if that first blood check at a month looks good, I have no problem without regularly checking further at that point. Okay? All right. All right. Good luck to you. Hello, Anna. Let's see, Dr. Ross. I would like to introduce LDN, which is low dose naltrexone, everyone. But I occasionally use Ultram, Tramadol, and pregabalin Lyrica. Any suggestions for phasing out narcotics with low dose naltrexone? Can you use low dose naltrexone if you substitute oral painkillers with topical cream containing ketoprofen, gabapentin, amitriptyline, and baclofen? All right, let me answer that part first. Okay, so naltrexone, everyone, is a narcotic blocker, and it also blocks our own natural narcotic system, which are called endorphins. Our endorphins that we make to manage pain also regulates our immune system. And it appears if you've got an overactive immune system that's attacking you, in other words, autoimmune disease component to your illness, that if you cause temporary blockades of endorphin receptors in the body, that can turn down an overactive immune system. It can rebalance it, okay? All right. So when we do low-dose naltrexone, the reason it's called low dose is the drug itself is manufactured as a 50 milligram pill. And in a 50 milligram dose, it doesn't let go of those narcotic receptors too quickly. And so if you were using full strength, I would say, no, you should not be using anything that's narcotic. And by that, I would say is the Tramadol, pregabalin, I don't think there's going to be any interaction with it, but other narcotics to consider. So Tramadol is a very weak narcotic, and I think it's questionable whether we even call it a narcotic, but I guess it is called that. Other narcotics would be things like oxycodone, hydrocodone, hydromorphone, morphine, those kinds of things, okay? Now, any narcotic that is short-acting, you probably still can use when you're on low-dose naltrexone. But here's how. The low-dose naltrexone, because we prescribe it as a 1.5 to 4.5 milligram pill, doesn't last that long. It doesn't block your narcotic receptors for that long. It probably blocks them for about 4 to 6 hours, okay? So what I'll tell a person to do if they want to use narcotic painkillers is they can use them, but they should be using them at least 6 hours or more after they took their low-dose naltrexone, okay? It's nothing I encourage on a regular basis, but it's something you might be able to get away with. And again, with that one, I would talk it over with your physician and get their opinion on it as well, too, before you do something like that, okay? All right. Let's see here. Number 2, which of the following binders for ochratoxin is the gentle... pull back here with my eyes. I'm having a hard time reading that one. Let me see here. Oh, gentlest for the stomach. And then you list out the choices. So cholestyramine, charcoal, bentonite clay. How long can you use them safely and without side effects? Can you use those binders concurrently, or is it best to take cholestyramine away from charcoal and clay? Thank you. Okay, so binders, everyone, are things that bind up toxins in the intestines, and specifically, these binders are used to bind up mold toxins. How do mold toxins get in the intestines? Well, what happens, there's about 25% of people are susceptible to having something called mold toxin illness. And what happens in mold toxin illness is that your body is not set up to adequately remove the mold toxins. And so what is supposed to happen is when you breathe in a mold toxin from the world around you, usually from wet buildings, those mold toxins get absorbed through the lungs into your bloodstream. And inside the bloodstream then, some of your white blood cells will see those mold toxins and they'll get tagged by those white blood cells. And then other white blood cells will come in and break those mold toxins down. Okay, that's how it's supposed to work, okay? Now, in 25% of people, it doesn't happen that way. 25% of us have a genetic programming error where we cannot remove mold toxins. So those mold toxins don't get tagged. They go to the liver still as a fat-based toxin, and the liver is supposed to transform things that are fat-based into water-based, and if it was able to, it would transform these mold fat toxins into a water-soluble toxin, pass it out to the intestines where it would mix in our poop and we'd poop it out. But that doesn't happen either because the liver is not able to handle mold toxins. So they go to the liver as a fat-soluble toxin and they come out as a fat-soluble toxin. And out in the intestines as a fat-soluble toxin, they get reabsorbed right back into the bloodstream. So you get this endless loop of just recirculating toxins, okay? So those toxins, one of the things that they cause inside your bloodstream is they trigger your white blood cells to over-manufacture cytokines. Many of you have heard me talk about cytokines many times because your immune system makes too many cytokines when you have Lyme, when you have Bartonella, when you have too many yeast in your intestines, and when you have mold toxicity. And too many cytokines make it so you can't think, make you hurt, interfere with your hormonal systems, give you fatigue, disturb your sleep. That's what we call Lyme symptoms, right? So Lyme symptoms are really too many cytokine symptoms, and that's why mold toxicity can look like Lyme. Too many yeast in your intestines can look like Lyme because they all produce too many cytokines. They cause the immune system to make too many cytokines, okay? So the approach is you want to grab hold of the mold toxins out in the intestines. And it's binders that do that. And there's a variety of binders we can use. You've listed some things here, cholestyramine, which is a prescription, charcoal, bentonite clay. Okay. Now, these binders you can take all together. All right. You could, if you wanted to put together a regimen that used 3 different binders like this, because they all have different affinities for different toxins, you could take them directly at the same time. Okay, to answer that part of your question. Okay. In terms of which one is harder on the stomach, so I haven't found any of these to produce nausea, for instance. Okay. The cholestyramine, though, can tend towards constipating a person versus the charcoal and the bentonite clay do not do so as much, okay? The adverse outcome of charcoal, though, is charcoal can remove a lot of minerals versus cholestyramine tends not to, bentonite clay tends not to. And the trouble with charcoal, if you use it long term, it may remove enough minerals that it starts causing hair loss, okay? So if I'm treating somebody with activated charcoal and they start getting hair loss, I will do my standard thing, which is check for thyroid levels and check for iron levels by measuring a chemical called ferritin. But if they come back normal, then I'm going to start assuming it's the activated charcoal that's leading to the hair loss, okay? And for the activated charcoal, if you have hair loss and activated charcoal, one of the things you could try is to replace the minerals that the charcoal is pulling out. And that would be to take, I like using a product to do that made by Research Nutritionals, which is called Core Minerals. And it would be something you take 1 pill twice a day on that. Okay. All right. I think that's your question. I think I answered your question. All right. Thanks, Anna. Good luck to you. Hello, Brandy. What are the side effects of low-dose naltrexone? Do any of these infections go after the diaphragm, causing a weak, wispy voice? So, a weak, wispy voice may not be the diaphragm, okay? It could be that the nerves that make your voice box work correctly are impaired. And what could cause impairment of the nerves that make the voice box work correctly would be either Bartonella or Lyme. It is also possible that Bartonella and Lyme can infect the nerve that makes your diaphragm work correctly. But with that, usually it's more you're going to feel short of breath because your diaphragm is going up and down, makes it so you can breathe, basically. Okay. All right. In terms of naltrexone and side effects, an occasional person will get some nausea. Some people get insomnia on it, and because of that, I recommend that people take it in the morning, not at nighttime. I know there's a lot of doctors that recommend at night, but if you look at effectiveness of it, it's as effective in the morning as it is at nighttime, as far as I'm concerned. And there's too much chance of getting insomnia, so I don't have people take it in at nighttime. I have them take it in the morning. An occasional person will have some confusion on it. An occasional person might have some night terrors on it, but generally it's pretty well tolerated. Okay. All right. Thanks for that question, Brandon. Okay. Hello, Lynn. Let's see. Hi, Dr. Ross. I took a series of antibiotics and herbal medicines for Bartonella. After finishing the antibiotics, I continued the herbals, Hutania, Cidacuda, and MC Bar, until I've been symptom-free for a year. After coming off the herbal meds, I had a recurrence of Bartonella and suspect that even though I had been without symptoms for a long time, the withdrawal of the herbal antibiotics allowed persisters to get active. I'm now back on the herbals listed above, and I have added the liposomal oregano, clove, and cinnamon oil to address persisters. Symptoms are abating. What do you think would be a good length of time to continue this protocol to thoroughly treat the recurrence of Bartonella and its persisters at this point? I would go at least 4 to 6 months. That's what I would do in my practice, okay? I don't have any clinical studies to prove that that's the best way, but I usually have pretty good success using about 4 to 6 months of treatment by adding in something that will treat for persisters, okay? So everyone, what Lynn's talking about is one of the reasons that her Bartonella may have relapsed is one of the things I was talking about earlier. We know that Lyme has these growing forms and has these hibernating forms. And about a year and a half ago, we discovered that Bartonella does too. Okay, there's research that came out of Johns Hopkins University about a year and a half ago that got published in December about a year and a half ago that showed for the first time that guess what? Bartonella has biofilms and Bartonella has these persister forms. Okay, now if you look at some of the research data that we have that got published on Lyme biofilms about back in probably about 6 years ago out of Boston or Northeastern University in Boston, those studies showed that maybe about 20% of cells, Lyme germ forms, when they're exposed to ongoing antibiotics would turn into persisters. Okay, so I want to be clear. All of us are not that have these disorders are not riddled with persisters. Okay, all right. It's just that some of the germ forms go into persisters. And we think, based upon existing research, that the standard antibiotics that we use don't treat persisters, okay? And so that's started the hunt for looking for things we could use to treat them. And so Johns Hopkins has been able to show that combinations of oregano, clove, and cinnamon, or even straight oregano, does a good job of treating both persister forms of Lyme and persister forms of Bartonella. The other thing that looks like it works really well against both Lyme and Bartonella is a compounded medication, which is called methylene blue, which is something you would have to have mixed up by a pharmacy. Okay, but that's another option to consider as well too. Okay, all right. Good luck to you, Lynn. Thanks for that question. Hello, Thomas. Let's see. Did you ever see anyone get benefits from FMT? I think what you mean by FMT is fecal microbiota transplant, or basically taking either a source of poop, if you will, from somebody else and having it put into your rear end by an enema, or by taking freeze-dried capsules of it as well too. Okay, so what's the purpose in that? So, fecal microbiota transplant is currently only approved and allowed for one use in the United States, and that is to treat drug-resistant Clostridium difficile infections. Okay, so C. difficile, Clostridium difficile is a bacteria that lives in the intestines, and it's one of those rare bacteria that grows too much when you're on antibiotics, and it can, if it grows too much, it releases a bunch of toxins that give you very bad watery diarrhea. A standard antibiotic treatments we can use involve things like Flagyl, vancomycin, another one I'm blanking. There's a third drug we can use, but I'm blanking on it. But if they don't work, then what has been shown with some science is that doing a fecal microbiotic transplant can help with that. Okay. Now, when we first started doing a lot of this, all of us were starting to wonder, wonder if we can use it for other purposes too. And those other purposes would be if we get somebody that's got just terrible imbalance of their bacteria in their gut, from having been on lots of antibiotics, and even though they took probiotics, they just continued to have severe gastrointestinal dysfunction. Some of us wonder, could fecal microbiota transplants help with that? And a number of years ago, we could get it for those purposes. So for instance, I had a patient of mine that just had, after doing courses of antibiotics to get rid of her Lyme and Bartonella, had to develop persistent gassiness and bloating and disruption in how her gut worked. And the one thing that did give her benefit is we eventually arranged through a clinic at that time that was down in Florida for her to get a fecal microbiota transplant. And that was a game changer for her. That caused her intestines to start working correctly. Okay. But the trouble is the FDA it now says basically that you can only use these things for C. difficile infections. That's it. Okay. All right. So yeah, that's my thoughts on it. So good luck to you, Thomas. Hello, Justin. What are fulvic, humic acid, and shilajit? I don't know what shilajit is. I haven't heard of that one before. Fulvic and humic acid are breakdown products, substances of organic plant matter and animal matter. Okay. So it's a decomposition substance, basically. But they are used sometimes in supplements because they help bind toxins. All right, so you can use them to help bind toxins. Hello, Alex. Hi, Dr. Ross. I've been diagnosed with ME, chronic fatigue syndrome, 6 years ago, and recently with Lyme. I seem to relapse every 4 to 6 weeks, bedridden for a week, and fatigue, muscle twitching, confusion, irritability, and sensitivity to light and noise, etc. Why does this 4 to 6 week cycle exist? And how can you tell the difference between Lyme, ME, CFS? Many thanks for you and dedication. Alex from Western Australia. All right. So, ME CFS is a diagnosis of exclusion. Basically, you have severe fatigue, sometimes muscle achiness, sometimes repeat infections, and cognitive dysfunction. And when we cannot identify any other explanation for those illnesses, we call it chronic fatigue syndrome. okay? We don't have a test that proves it's there, but we try to rule out anything else that might cause that, okay? So one might say that if you've been found, and so you now have a diagnosis of Lyme, and if you have Lyme, it would be Lyme that probably is causing the ME/CFS, and you probably would not say you have that anymore. You probably say you have Lyme disease, okay? And with symptoms of Lyme disease. And so in Lyme, what causes all those problems, a lot of them are the excess cytokines that I was talking about earlier, okay? All right, now, one of the things, a clue that would have had me wondering about, so then whenever I have somebody that comes to see me in my office that comes in with a diagnosis of chronic fatigue and fibromyalgia, I'm always looking to make sure that they don't have Lyme, because there's an overlap. And what I found in my practice here in Seattle, Washington, back in 2004, when I first discovered a patient of mine had Lyme, because she asked me to test for it. I wasn't even looking for it. And at that time, my practice was predominantly made up of people that had chronic fatigue and fibromyalgia. That's what I was treating, right? And so one of my patients asked if I would test her for Lyme, and I did, and it came back positive. And so that was an eye-opener for me, and it made me go back and retest all of my patients that had been diagnosed with chronic fatigue syndrome and fibromyalgia to see, could they have Lyme disease, actually? And in my Seattle, Washington practice, I found that 30% of people had Lyme. Now, that's my experience here. Depending on how prevalent Lyme is in other parts of the world, it may be the same. I suspect here in the States, on the East Coast, in the New England states like Connecticut, where Lyme was discovered, out there where there's a lot more Lyme than we have out here, that probably people that have been diagnosed with fibromyalgia, chronic fatigue, there's probably even a higher percentage of those that are truly Lyme disease and as the cause of their problems, okay? All right, now there's one clue in your symptoms that makes me wonder about Lyme, and without even seeing your Lyme test, and that is that you get worse every 4 to 6 weeks. So there's a subset of people with Lyme that have that pattern, that they will worsen on a 4 to 8 week cycle. And there's no solid science to explain why that happens, but we think that it has to do with the growth cycle of the germ. We know the germ replicates about every 4 weeks to every 8 weeks. And as it does that, it seems to, with an increased germ load every 4 to 8 weeks, your immune system is going to react more strongly. It's going to manufacture more of those chemicals called cytokines, and it's going to make you feel a lot worse, okay? So that pattern is very unique to Lyme, of having a cyclic worsening that's pretty predictable, somewhere in the 4 to 8 week range of time frame. Depends on the person. Some people it's every 8 weeks, some people it's every 6 weeks. But if you see a pattern where there's a regular decline in that kind of a time interval of 4 to 8 weeks, some pattern decline, it often means that there's Lyme there, okay? That's been based on my experience, all right? Thanks for that question, Alex. Good luck to you. Hello, Sarah. Hello, Dr. Ross. What adjustments do you make from your normal protocol for patients with resistant Babesia? Do you ever use higher doses of Malarone than 2 pills twice daily? Do you ever use Tintamax for Babesia? Thank you. So, treatment-resistant Babesia is difficult, okay? And so generally when I treat Babesia, my first go-to drugs to use would be to use Malarone. As you mentioned here, it's Malarone, everyone, is a drug that's designed to treat malaria that actually has 2 different chemicals in it. One is called atovaquone, and the other one is a quinine derivative called Plaquenil, all right? And usually we'll couple it with some type of an intracellular antibiotic like azithromycin, clarithromycin, doxycycline, or minocycline, all right? Now, if I find that that's not effective for somebody, my next approach would be is possibly to leave them on that and then add in the herbal antimicrobial called Cryptolepis. And Cryptolepis comes to us out of Ghana, Africa, where it's been shown there to be quite effective against malaria. And about maybe 5-6 years ago now, many of us started trying it out in our Babesia treatments, and it has some good benefit for a lot of people. If I'm going to add it to that kind of a regimen, I would do it as 5 milliliters, a teaspoonful 3 times a day. Okay. If that doesn't seem to help, I used to try things like coartem. I used to look at using regimens that would use something called larium, which is called mefloquine. The trouble is that has a lot of psychiatric side effects. But these days, what I'm finding more and more effective when I've got treatment-resistant Babesia is I'm starting to work often with a regimen that includes using a drug called Primaquin and coupling that with Plaquenil, quinine medicine Plaquenil, okay? The Primaquin you would do as 2 pills 1 time a day, and the Plaquenil you would do as a 200 milligram pill twice a day. Now, the Plaquenil is what's talked about in terms of treating for malaria when you use that combination. But in the world of Babesia, if you can't tolerate Plaquenil, you could use another agent. So for instance, if you can't tolerate Plaquenil, you could try a Cryptolepis. You could maybe do Primaquin with Malarone. So anyway, there's options you can use as your other anti-Babesia agent you would add to the Primaquin, but often we'll start with Plaquenil for that. And that tends to be what I find to be an effective treatment. Okay? All right. Thanks for that question, Sarah. Hello, Nancy. Let's see. Hi, Dr. Ross. To refresh your memory, I had a great consult with you several weeks ago. I'm about 90% better from Bartonella with remaining rib cage pain, some fatigue, but very bearable compared to how sick I was. You recommended liposomal oregano oil, hutania, and some other supplements to finish treatment. I had been on antibiotics early on. I wrote in 2 podcasts ago that the liposomal oregano was making me nauseous and caused vomiting even. I tried to stick with it for weeks, but it did not get better. On the podcast, you suggested trying DGL before taking the liposomal oregano oil. This hasn't helped. Can you recommend an alternative to the liposomal oregano oils that is not a pharmaceutical? My T-Lab shows I have had BART, but also high biofilms in spite of all the biofilm busters I've had, like on Paluki. Thank you. So I don't know of another non-pharmaceutical alternative, unfortunately. So where I've learned about what to use to treat persisters Bartonella is based upon the research that comes to us out of Johns Hopkins University, out of Dr. Ying Zhang and his lab there that's looking at novel treatments to treat Bartonella and Lyme, focusing a lot on persisters. You know, he's been able to show in his experiments that for Bartonella, you can use the oils, like I just talked about here. You can use a prescription compounded medication called methylene blue that appears to break apart biofilm and kill persisters. He's also shown in his research that you could use the pharmaceutical called clotrimazole, which is in the family of antifungal medicines known as the azoles. So other azoles are fluconazole, itraconazole, but he only tested clotrimazole. So one wonders if clotrimazole would work against persister BART, maybe the other azoles would, like fluconazole and itraconazole, but they weren't tested in his experiments, okay? But I have no other herbal options for you that I'm aware of based on any science, okay? So I'm sorry about that, Nancy. The only, I'm just trying to give you some other ideas here. So the reason I said to try the the licorice is, or the rhizosinate licorice, or deglycerated licorice, is when you chew licorice and your saliva will interact with chemicals in the licorice, and that can create a microscopic gelatinous coat that covers the stomach, okay? And I've found success with that maybe about 75% of the time in my patients that get really nauseated on the liposomal oregano, clove, cinnamon oil, all right? The other thing that that could help, and I just haven't tried it, so you would have to give it a try and see, all right? There's also something called mastic gum, all right, mastic gum. And when you mastic gum also helps provide protection to the stomach. That's an herbal option as well too. I would have to look up how to use it. You could look that up. I mean, you just want to look at mastic gum for gastritis or mastic gum for ulcers. Just Google it and you'll find recommendations about how to use it. But mastic gum could be something you also try in addition to trying the licorice to see if you can tolerate this. But in terms of other natural options, I'm just not aware. I haven't seen any research. Dr. Ying Zhang has not produced research that I'm aware of. And I'm pretty up on the research, but every now and then he sneaks an article out there that I'm not aware of. But I'm not aware of another article out there that says there's another herbal option for the persisters. Okay. All right. Good luck to you, Nancy. Hello, let's see here. Hello, C. Let's see. Hi, Dr. Ross. Can you recommend some of your favorite websites dealing with current, reliable, pertinent medical research, especially as it relates to Lyme co-infections, mold toxicity, immune malfunction, etc.? Thank you. I don't have any one website that I go to. I periodically just go out and do my own online searches at a place called PubMed. PubMed is a search tool that you can use that goes through the whole database at the National Library of Medicine. So I'll just periodically type in Bartonella and see what's been produced in terms of research over the last 6 months, and then read articles and see what that tells me. Or I might type in mold toxicity and see what I learned from what comes up. But there is not any one website that you can use to do that for you. Okay? All right. Good luck to you. Thanks for that question. Hello, Joyce. Let's see. Hi, Dr. Ross. When a couple of weeks after getting the COVID vaccine, started experiencing severe neck pain radiating to the upper back and over time spreading to behind the ear and the base of the skull with shooting pains into the head and ongoing relentless headaches. Having gone to several doctors, no one can give an answer. Nothing else has changed. Is this anything you're familiar with? Thank you as always for sharing your knowledge. You know, Joyce, I'm not. I mean, I understand that there is a time relationship to the vaccine. Having a time relationship to the vaccine does not necessarily mean the vaccine caused it, but I can understand wondering if the vaccine caused it. It's not a common effect I have seen. I would be looking to see, is there another cause for this? And I would be looking specifically at your neck to see if there's anything that's being pinched in the neck. I might even consider getting MRIs of your neck to see, is there any evidence of nerves being pinched that somehow came on at the same time. Okay, that's what I would be looking to do. All right. Good luck to you, Joyce. Let's see here. Hello, Clay. Hi, Dr. Ross. Can dog tick bites cause swollen lymph nodes? Would swollen lymph nodes after a dog tick bite be a sign of tick-borne infection that needed treatment? Are tick testing labs like the one at UMass reliable? Do herbal antimicrobials harm the gut bacteria? Thank you so much. So in terms of your gut microbiota and the good bacteria that line the intestines, clearly we know from science that prescription antibiotics can interfere with the good bacteria. My experience tells me that although the herbal antibiotics have less of a chance of disturbing the good bacteria, they can. And the reason I'm saying that is I've had numbers of people that basically developed yeast overgrowth in their intestines while on herbal antibiotics. And so that would suggest that the herbal antibiotics knocked down the good bacteria that were living there that kept the yeast under control. So I have seen it happen, although I got to tell you, it's less of a chance of happening compared to prescription antibiotics, okay? And then, I would have to go back. I don't know off the top of my head. I always have to look this up. But yes, dog ticks can transmit some germs. They don't transmit the Lyme infection, but I do think they might transmit Anaplasma, maybe Ehrlichia. Hold on just a minute. We're going to look it up together. Oh, hold on, man. I got to do a screen share so we can look it up together. Let's see here. All right, so we're going to just ask Google, what germs do dog ticks transmit? Let's see. Rocky Mountain spotted fever is one. Let's see what. I'm not finding it here. There's a research article that I usually pull up, and I'm not finding it. There are some germs that can be transmitted by dog ticks, but typically we don't think of dog ticks as transmitting Lyme. I just want you to know that, okay? I think Rocky Mountain spotted fever, and I do think maybe Anaplasma. But if you're having swollen nodes after a dog tick, it would be my inclination to probably go on a tetracycline, maybe up to about 3 weeks. But that's my opinion. There's no solid science behind that. Okay. All right. Good luck to you, Clay. Hello, Danny. Let's see. What is the best treatment for neuropathy? So neuropathy, everyone, means nerve injury. And neuropathy can show up as numbness, tingling, or as nerve pain, which would be sharp, stabbing, shooting, burning, piercing, or electrical qualities of pain. All right. So first of all, your treatment is figure out what's irritating those nerves. All right. So it could be Lyme, could be Bartonella, might be mold toxicity. Those are things that to think about. I will let you know that about 50% of the time that somebody has neuropathy, we cannot identify a cause. Right? So 50% of the time you go to a neurologist and they look at you because you have neuropathy, they will tell you, I don't know why. That's true. We don't know why. Okay. So, but a workup should it look and see, do you have Lyme? Do you have Bartonella? Do you have mold toxicity? Also probably look to see if there's any type of an autoimmune illness by measuring things like rheumatoid factor, anti-nuclear antibody. You would want to check vitamin B6 levels. If you have too much B6 in you, it can give you neuropathy. You want to check a vitamin B12 level. If you don't have enough B12, you can have neuropathy. And in extreme situations, I might even look for heavy metals to see if there might be heavy metal toxicity leading to neuropathy too. But even when we do all that testing, 50% of the time, we never identify a true cause of what's happening with the neuropathy. Okay, so number one, identify the cause. And if it is Lyme, treat Lyme. If it's Bartonella, treat Bartonella. If it's mold toxicity, pull those mold toxins out, okay? So number one, get rid of the thing that's hurting the nerves, all right? Number two, repair the injury, all right? So when your nerves get injured and they're not working correctly, often there also will be a degree of injury that has occurred to the cell energy factories in nerves, or actually they're found in every cell, but they're called mitochondria, all right? So as part of getting your nerves to work correctly, you're going to want to do things to fix the mitochondria. Now, it just so happens that the things that we do to fix the mitochondria also fix the nerves, all right? So we know from good studies involving diabetes that if you can raise glutathione inside of your nerves and inside of your mitochondria, it will help both work better. All right, so mitochondria, the energy factories, you want to repair them so that your nerve cells have enough things to heal. Okay, so one thing to do is glutathione. And I like people to be on a liposomal glutathione. Liposomal means that it's glutathione that's microscopically wrapped in fat to increase its absorption. The product I like best to do that, and this is based on my experience, what I see with my patients, but also based on some good research published by Research Nutritionals, is a product by Research Nutritionals, and that product is called Trifortify, and there's a Trifortify Orange, and there's a Trifortify Watermelon, okay? You want to do 1 teaspoon 1 time a day, right? Number two, you want to fix the covering of your mitochondria and the covering of your nerve cells, your nerve cell membranes. And it just so happens that the same fats that make up the covering of the mitochondrial membrane, or compose the covering of the mitochondrial membrane, and compose your nerve cell membranes, they're the same fats. They're a group of fats called phospholipids, predominantly made up of something called phosphatidylcholine and phosphatidylserine, all right? So you want to fix those, you want to repair them. And so you can use a supplement that does that. And so my favorite supplement for doing that is a product also by Research Nutritionals, which is called ATP 360. It is a phospholipid mix that has phosphatidylcholine, phosphatidylserine, and a number of other phosphatidyls in it. And in addition, it has some micronutrients in it that help your mitochondria work too. And you would do 3 pills 1 time a day. Okay, now the only time you don't want to use that to do your phospholipid repair is if you happen to be treating Babesia with either Malarone, atovaquone, or generic Malarone, okay? And if you are, you don't want to be on CoQ10 that is also found within the ATP 360, because CoQ10 interferes with how atovaquone works, all right? So instead of doing the ATP 360, then what you would do is a product also made by Research Nutritionals, which is called NT Factor. And that it has most of the same stuff in it, similar stuff in it that the ATP 360 does, but it doesn't have any CoQ10 in it. So you would do 2 pills 3 times a day of that, all right? So the 2 essential things I would have anyone with neuropathy do is be on glutathione, that Trifortify product, as 5 milliliters 1 time a day, and then fix the membrane of the nerve and the mitochondria by doing ATP 360, 3 pills 1 time a day, if you can use CoQ10. But if you're treating with Malarone or something with atovaquone in it for Babesia, then you got to do the NT factor, okay? All right. 2 other things. If you have significant nerve injury and you're a vegetarian, you might also want to add another supplement called carnitine. And I like using a form of carnitine called acetyl L-carnitine. And for that, I like a product made by Thorne called Carnitil. All right. Carnitine is a protein that is used as a transport vehicle to carry, or an amino acid, I should say, amino acid substance that is used to transport fat from the outside of the mitochondria across the mitochondria membrane to the inside, where it is burned into cell fuel. And you get it from red meat. So if you're a vegetarian and you're not having red meat, meaning beef or lamb, you may not be getting enough carnitine to carry in, to go across that mitochondria membrane to carry the fat in, okay? So I usually will start somebody on this thorn product called Carnityl, Carnityl, and it's a 500 milligram pill. I would do that one pill twice a day for a month and then decrease it down to one pill a day, okay? And then in real extreme cases for neuropathy, I sometimes also will add in coenzyme Q10. And that's used by your mitochondria to carry electrons around the mitochondria, okay? And so that is a 400 milligram pill, and that's one pill twice a day. Again, I like a product by Research Nutritionals for that as well too, okay? All right, so those are my steps to fix neuropathy. I have an extensive article I've written about this that pretty much covers everything I just said. Let me show that to you here. All right. Okay, so take a look at my online Lyme guide and take a look at this section on brain and nerves. And then take a look at this article called Neuropathy Repair. It's where I walk you through all the steps that I was just talking about, okay? And then if you are interested in those products I was talking with you about, this is my supplement store, Marty Ross MD Supplements. Basically anything that I recommend to treat Lyme, or supplements that I recommend or that I use, you can get here. These are the same supplements I use to treat my patients here at the Healing Arts Partnership, or at Marty Ross MD Supplements, okay? Previously called the Healing Arts Partnership. So in terms of the Trifortify, these are the Trifortify products, okay? And then in terms of the Carnityl, which is that acetyl L-carnitine, that's your product there, right? And then in terms of the ATP 360, that's your product there, okay? Now, terms of if you, so, and again, anyone can buy here, and I appreciate your business, because what you supporting the store supports my ability to keep working with you here in this forum as well too, okay? Be aware that I sell these as low as the manufacturers allow me to, and because I still want to try to save you some money, I pay for all the shipping, and I'll also cover any taxes if you happen to be in a place that you would have to pay sales tax, okay? So I try to defer costs as much as I can. I can't sell these things any lower than the manufacturers allow me to, though. Okay. All right. All right. Go back here. All right. Good luck to you, Danny. Hello, Gail. Let's see. Bitten by a tick in Bloomington, Indiana in early June. Found tick in Denver 2 days later. No rash, no symptoms other than nerve pain in an area of a tick bite on an ankle going up leg a bit. This is for several weeks. Took 10 days of doxycycline in mid-June. Pain has subsided the last 2 days, but if it returns, don't know if I should take 21 days of doxy or consider it as not connected to the tick. Thanks. So first of all, keep in mind that every tick does not carry Lyme. Okay, I just want to let you know that. Now, it depends on where you are in the country. So different areas of the country have a higher risk of you getting Lyme from a tick bite, all right? So for instance, in New Jersey, 95% of ticks carry Lyme, all right? Northern California studies tell us that 40% of ticks carry Lyme. I don't know what the rates are in Indiana, but they're probably much less than out on the East Coast. So you probably have maybe a 20 or 30% chance that you might have gotten Lyme, okay? Keep in mind, though, ticks can also transmit Bartonella. Generally, when I've got somebody that's got a tick that's attached for at least as long as this one has been attached, I'm going to want to do as my initial course of antibiotics at least 3 weeks. Okay, at least 3 weeks. If somebody doesn't have any other symptoms other than they had a tick bite, okay? At this point, if you're not having any remaining symptoms, I probably would not give you any more antibiotics. I would just wait and see what evolves, okay? But if you were a patient of mine and the symptoms were to return, I would definitely probably go about 6 weeks of antibiotics the next time. Okay. Now, all these things I'm talking with you about, you should talk it over with a physician, okay? Because I'm not your physician. I'm just answering questions here in a webinar, okay? But that's the approach that I would wind up using, okay? All right. Good luck to you, Gail. Hello, Sharon. Let's see. I have chronic Lyme, infected in 2000, not diagnosis or treated until 2009. I was actively treated for a number of years, but now I have extreme dizziness and imbalance. I still take clarithromycin 2 times daily and just started vestibular therapy, but it seems to be making worse. Any thoughts? Thank you. So I would want to ask you a lot of questions to see if there's any other symptoms going on besides dizziness. So just dizziness and imbalance on their own do not necessarily mean you have tick-borne infections. I would want to be looking to see, do you have fatigue? Do you have cognitive dysfunction? Do you have any ongoing body pains? The more of those symptoms that you have increases the chances that this could be a tick-borne infection, okay? And if it is a tick-borne infection, then you would want to treat for it while you're going through these kind of therapies. In terms of figuring out the symptoms that suggest Lyme and the symptoms that suggest Bartonella, which would be the big two I'd be thinking about, I would take a look at the 2 articles that I have put together about how do you diagnose Lyme and how do you diagnose Bartonella. Okay, let me show you where you would find those. Okay, so take a look at my online guide here. Take a look in my section called How to Diagnose. Okay, this is the article about how to diagnose Lyme. In this video article, you'll see a big list of symptoms that make you wonder about Lyme. And then for Bartonella, here it is. Take a look at this article called Is it Bartonella? I review in here. I wrote down in here, actually, the symptoms that you might look at that make you think of Bartonella beyond just dizziness, okay? All right. Good luck to you, Sharon. Hello, Gail. Again, let's see. I forgot to say that I would only take Doxy if really felt it was needed because of what it does to the stomach. I had very bad intestinal infection from India, for which I have recovered, but don't like to upset it if I can help. Was wondering if Doxy type injection would work if needed. So there isn't a Doxy butt muscle injection. You can get doxycycline IV. The trouble is, who's going to prescribe it? Okay, so it's usually too hard to get. All right. Good luck to you. Hello, B. Let's see. Do you recommend pure encapsulations, grapefruit seed extract, or the one from Allergy Research? I noticed some difference in their ingredients, and the Allergy Research version says it's free from triclosan, benzothine chloride, and benzalkonium chloride. So, I've worked with both. In fact, I used to carry the pure encapsulations grapefruit seed extract, and now I work with the Allergy Research. I think the Allergy Research product is a cleaner product, okay? In terms of effectiveness, in terms of how they kill germs and work to get somebody better, I think they're both pretty equal when it comes to that, okay? All right. Good luck to you. Hello, Patricia. Hold on here just a minute. Okay, so I have SIBO that won't go away on Xifaxan for 2 weeks, AR/BR candibactin, and oregano oil for 3 weeks. It was suggested that I take FC-Cidal dysbiocide next to get rid of the SIBO. I have positive Lyme IgM through IGeneX results. Should I continue to try to get rid of SIBO first before treating Lyme? Or can I go after the Lyme right away? So in my own experience, if you've got a lot of SIBO and then you start trying to add antibiotics in to kill the Lyme, it's only going to make the SIBO worse. And it's going to make it harder to take those antibiotics because you're going to get a lot of stomach discomfort. My own practice is, when possible, before I start treating, try to get rid of the SIBO. Okay. Now, I will also tell you, though, I have a number of patients that develop SIBO while they're on Lyme treatment, and I still keep the treatment going while I address the SIBO. So it is possible to do them all together, but my practice generally is to try to clear the SIBO first, okay? All right. Good luck to you. SIBO, everyone, stands for small intestine bacteria overgrowth, okay? And basically you get bacteria living in your small intestines that aren't supposed to be there. They migrate up from the large intestines, and then they start fermenting your food and give you a lot of gas and bloating. The other thing they do is they trigger the immune system to make too many cytokines. As many of you know from my webinars, it's the cytokines that make you feel sick. With Lyme, cytokines make you feel sick when you have mold toxicity. It's the cytokines that just make you feel sick in general, okay? All right. Hello, Patricia again. Let's see. In regards to IGeneX, previously I was IgG positive for Lyme and IgM negative, but now IgM positive and IgG negative. My PCP is confused. How could I now be IgG negative? Do you think IGeneX is accurate here? So yeah, I do think IGeneX is accurate, but one thing that I've looked at studies about antibody production in Lyme, it will come and go. So sometimes you will be making your IgGs and sometimes you won't. And it has nothing to do with the accuracy of the lab, but rather we periodically go out of a state where we make them and sometimes we don't make them. Okay? All right. Thanks for the question, Patricia. Hello, Janet. Let's see. I have Lyme and Bartonella, probably Bart since I was 12, and recently started rifampin again with clarithromycin. I had taken it in 2014 and again in 2017 with no problem. However, this time it seemed to hit me hard, triggering nausea, rapid heart rate, and a hyperthyroid response. I'm on a combination of synthroid and desiccated thyroid. This past year, I've had to adjust my thyroid meds by reducing them as I was starting to occasionally flip into a thyroid storm. I've been on thyroid meds since 2012. Could this reaction to rifampin be a combination of a HERX as well as rifampin side effect on the thyroid? Yeah, I would need to ask you a lot more questions to give you more of a definitive answer, but I will try to answer part of that. So typically rifampin leads to hypothyroid. It typically causes low thyroid, not hyperthyroid, all right? So I'm not clear from what you've written here as to why the high thyroid is happening, to be honest with you, okay? I'm sorry, but that's the best answer I can give you there. All right. Good luck to you, Janet. Hello, Elizabeth. Let's see. My daughter and I have been sick from Mexico where she had, or have been back from Mexico where she had hyperthermia as well as ozone blood therapy and hyperbaric oxygen. She did very well for a few weeks after, but now many symptoms have returned, such as head pressure, neck shaking, internal shaking, and burning. She has been taking biocidin for the last 3 to 4 weeks, but seems to have symptoms that are becoming worse. Would your opinion be that she is herxing from the biocidin or the illness itself? All right. So my opinion, and again, I would need to ask a lot more questions, is that this is probably the illness. So I'm extremely skeptical that hyperthermia, as well as hyperbaric oxygen and oxygenation therapies like ozone, lead to long-term improvements in this illness. And let me just talk about hyperbaric oxygen and ozone first, okay? So these are oxidation agents, and especially the ozone is an oxidation agent. Now, ozone looks thrilling when you look at it in the lab. If you put ozone on a petri dish that's full of bacteria, those bacteria all die. So everyone automatically thinks, aha, ozone, that we're gonna avoid antibiotics and we're gonna go on ozone and it's gonna kill everything. I want my IV ozone, I want my rectal ozone, I want to drink ozone. And you know what? It doesn't work. And the reason it doesn't work is is that our blood is full of antioxidants, okay? So ozone is an oxidizing agent. And if you add it to something that has a lot of antioxidants, it neutralizes its killing effect. All right. In fact, one of the physicians that is one of the biggest proponents of using ozone to treat a variety of illnesses in the world has done a study where he looked at taking a test tube full of germs, putting ozone in, and then taking a test tube full of germs, putting a drop of blood in, and then putting ozone in, and then watching to see if it would kill. And guess what? It didn't kill because even a small drop of blood has enough antioxidants in it that it will neutralize the killing effect of ozone, all right? Now, when you do ozone or you do a hyperbaric oxygen, the reason you feel better right away, and it may even last for a week, maybe 2 weeks, maybe 3 or 4 weeks, maybe a little bit longer, is both of those are oxygenation therapies that lead to more oxygen getting into your mitochondria, your cell energy factories. And if you give an oxygen burst to your mitochondria, it's going to generate more energy. So you're going to feel better, okay? But it's not sustainable, okay? In terms of hyperthermia, hyperthermia, where it comes to us out of the worlds of syphilis, where it was used prior to having antibiotics. And it may have given people some benefit, but it was not universally successful. It is possible that when you heat the germs up, that you may kill them, but it doesn't mean you're probably going to reach every germ, every place in the body, even though a lot of these people say it does, all right? And I see just repeated failures from hyperthermia treatments, all right? So I'm skeptical that that is long-acting as well, too. So I think what probably has happened is, I would suspect, is your daughter did better for a while her mitochondria are working better from some of the supports that she had. And now as she gets further out from the supports, the illness is starting to show itself again, okay? And that you probably did not get adequate germ killing down there at all, all right? All right. Good luck to you, Elizabeth. Good luck to your daughter, too. All right, everyone. I think that's it for me for tonight. I've been having a headache the whole webinar tonight, and I'm going to stop 4 minutes early to take care of myself. So I still got through it, though. There was a beginning of the webinar tonight. I was wondering, am I going to make it through this with this headache or not? But I have. So I'm glad I was able to be here with you all tonight. Keep your eyes out on your email tomorrow morning. Hopefully somewhere between 5:30, between 9 and 9:30 in the morning. Maybe sooner, sometime sooner. You should get an email from me announcing that the recording is ready, and that I will have a summary of that recording as well, too. All right. The other thing that email will have is a link to sign up for next week's webinar as well. I would appreciate if you share those emails when I send them out, the ones announcing the webinar and the one that announcing the recording. Share with as many people as you think may get benefit from what we're doing here. We're trying to reach as many people as possible. Okay. All right. Good night, everyone. Good to visit with you again tonight, and I look forward to seeing you next week.